everyone, and welcome. My name is Angel Jakeways. I am a registered nurse. I also work in nurse recruitment at Valley Health. I am going to keep this a little shorter since today's presentation is virtual, and then we will stop at the end for any questions that you might have. I cannot see my screen, so if you have a question, either write it down, or if you choose to unmute yourself, then I'll be able to hear you. And then at the end, I will be able to see your faces and if you raise your hands and for the chats and questions. So Valley Health is a nonprofit hospital system. We are based out of Winchester, Virginia. That is where our largest facility is. We do have hospitals along with many other medical facilities, including physicians' offices, urgent cares, quick cares, standalone surgery centers, throughout Virginia at the top western corner and into West Virginia. Our 6 core hospitals, 2 are in West Virginia, in Romney, West Virginia, and Berkeley Springs. And then we have 4 in Virginia. The largest is Winchester Medical Center in Winchester, Virginia. And then we have locations in Luray, Virginia, Woodstock, and Front Royal. Couple of things that I like to share with all my students when I travel around and speak during these presentations. Wherever you decide to search for a career, a hospital location to work, I want you to always think about taking just a quick look at their mission, their vision, and their values. First of all, those are questions that very well could come up in an interview, but also you just want to make sure they align with your personal values, and the way that people are presenting themselves should align with the mission, vision, and values as you are going through your clinicals, your interviews, and you're starting your career. So our mission, serving our community by improving health. Our mission is our purpose. It's our exactly what we do on a day-to-day basis. Our vision is to inspire hope, promote health, as the community's first and best choice for high quality, safe, and affordable care. Our vision should be our goal, and this is what we hope to achieve. And values. This is the way people should present themselves and act on a daily basis. And again, that should be whether you're attending clinicals at a location, you're a patient at a location, a coworker, a new employee. These are the ways that people should be acting on a regular basis. Winchester Medical Center, as I mentioned before, is our largest hospital. The number there says 455 beds. That's actually now outdated. We've experienced some growth in the past year, and I've not updated my slide. We are 495 beds. We are a level 2 trauma center, level 3 NICU. What that means for both of those levels is that they're next to the highest level. So the level 1 trauma center would be the highest, level 4 would be the highest for NICU. Couple of reasons that we remain a level 2 trauma center. There are few patients that come in with some extreme burns that we do not keep to treat at our facility, and those patients are sent to a larger facility either in Baltimore or Washington, D.C. We also do not perform organ transplants at this time, and those are the 2 main reasons that we are level 2 instead of level 1 trauma center. We do see, treat, and take care of many, many traumas throughout the region. We're a chest pain center, advanced primary stroke center. We're doing minimally invasive surgeries. Such a cool thing, and what that means is surgeries that may have required a lengthy hospital stay for patients, we can now do with a minimal incision. So we can go in through a person's groin with a very minimal incision and rip one of their heart valves. That is extending the life for a lot of people who may not have been able to medically survive an open heart surgery can now have an extended life through minimally invasive surgeries. We're also doing a lot of cancer treatment surgeries, abdominal surgeries, things like that, using these minimally invasive and or robotic techniques. We are magnet designated, and we're pretty proud of that, especially because we've done it 3 times in a row. Again, our main location, Winchester Medical Center, is in Virginia, so my research is on hospitals in Virginia. But our magnet designation being 3 times in a row, we are one of 9 hospitals in Virginia as of last year when I did this research that had been designated 3 times. You've probably done some studying about magnet designation, so I am not going to dwell on exactly what that means. However, if you have questions at the end, I would be happy to answer those for you. One thing that it means for nurses and for your employment, higher job satisfaction statistically, lower reports of nurses having an intention to leave their position. You will also see that your voices are heard. I like to tell the story about expansion of 2 of our units, neuro and ortho, that happened last year. And we had committees prior to the expansion of these units going to various hospitals and doing research about what they would like to see in the new units that would be neuro and ortho. And those committees were made largely of nurses. And that is because we're a magnet hospital, so we wanted the nurses' voices to be heard. So it was not a lot of facilities maintenance people. It was made up largely of nurses. And that shows in the fact that the bathroom doors in the patient rooms are a little bit larger because nurses said, what if a patient codes in there? It sure would help if we could get a wheelchair in and out easier. And so that is the kind of thing that you can expect to see in a magnet facility. These are some of the other hospitals. They are not magnet. Magnet facilities have to have a wide variety of services that they offer and specialties. So some of our smaller hospitals will not be magnet, but they don't like to be outdone. So I've just listed a few of their achievements and awards. We do have a nurse residency program. That is for all of our new grads. So it does not matter which floor or unit you would take a position on, and it does not matter which of our hospitals you choose to work in. For your first year, you will have your nurse residency program to offer support, and you'll also have your unit orientation or preceptor. So your unit orientation may look like 12, 14, 16 weeks working with your preceptor. And then in addition to that, for your first full year, your nurse residency meetings will be about 4 hours long. You're paid to attend those. And you can expect to see people coming in and talking to you about just whatever we can do to help you transition from a student to a professional nurse. So it might be wound care coming to talk to you about how they can help in your day-to-day practice. It might be someone from our rapid response team, when to call a rapid response, what to expect when they arrive on scene. And it might be you and your fellow nurse residency partners saying some things that you need help with. Perhaps IVs are still difficult for you, and so you can ask if there's a certain way that you can get more practice with IVs. And so again, it's really designed to help our new nurses. Benefits, I've listed some of your benefits. If you choose to work at one of our locations that is more than 50 miles from your home address and you'd like to relocate, then we're happy to help with those costs. Again, it just needs to be more than 50 miles away from your home address. And then anytime during your first year of employment that you're ready to relocate, we will help you with some of those costs up to $5,000 reimbursable. And it would be things like if you rented a moving truck, you could turn in the receipt. We also have tuition reimbursement so that when you're ready to advance your degree, if you're a full-time employee, that is $5,250 annually towards tuition at the school of your choice. We do have contracts with a lot of schools to lower the tuition for our Valley Health employees as well. We have on-site childcare. What I love about that is that they are open 7 days a week and they are open for holidays. And they accommodate a nurse's schedule. They open at 6 in the morning and they close at 8 p.m. We have on-site wellness centers, employee discounts. There's a lot of local businesses that offer discounts if you show your badge, and we have a list of those. That could be things like buying new running shoes, going to the movies, going out to dinner, getting your car fixed. There's a whole list. And professional development. So we offer a variety of ways to obtain your CEUs. We offer in-person conferences. We offer online conferences. And then your unit will also typically have other events as well. Along with the benefits, we do have a zero deductible health insurance plan. You still have a co-insurance or copay, but that might mean that if you are going to get a CAT scan, for example, at a Valley Health location, and a Valley Health provider is the one ordering it, and you have Valley Health insurance, instead of having up to, an example could be some companies might have a $2,000 deductible that you have to meet. So you're paying 100% of your bill until you meet that. For us, we have zero deductible for certain services, and there's a list of those. And so then you would just have your co-insurance or your copay. In the end, it does save you a lot of money. Healthy U is a way throughout the year for you to earn points that turn into dollars towards co-insurances, glasses, medications, anything related to your health. Dental, vision insurance, short-term, long-term disability. For our 403B retirement plan, we do have a company match, and we also have the company or Valley Health puts in money to that. So after your first year, they start just putting money in, and I believe that's 3%, and then they have a match as well. Little tidbit for all students, as soon as you can, start applying money to your 403B retirement. Employee appreciation, healthcare, nursing, they're not easy positions at times. They can be high stress, they can be emotionally difficult, but we're in it because we love it. But we also like to show our family and our work family that we appreciate each other. So some of the things that we do, you might see a day when the cafeteria is closed and employees can have a free meal, and that is served by the executive team. Ice cream socials, painting rocks. Last year, we rented out the drive-in movies here locally, and we allowed our employees and their families to come for a free movie showing of The Lion King. We did it for 2 nights. You just had to sign up online saying that you would be attending with your 3 guests, and it was free popcorn, bounce house, and entertainment as well. Very involved in the community. I mentioned before that we are a nonprofit hospital system. That means that we do give our profits back to our community. So lots of opportunities to give back to the community that you're living and working in. Couple of things to note about our application process. Everything does start electronically or online for us. So we would ask that you complete an application for a position. We do like you to consider applying to more than 1 unit or area of nursing. For example, if you absolutely love the emergency department and you want to be an emergency department nurse, go for it, apply. But we also ask you to consider 1 other unit. Maybe that could be a telemetry unit, pulmonary, renal, medical, surgical, oncology, neuro, ortho. Just pick at least 1 other unit. The reason we say that is because perhaps there's been 15 other people applying to that one position in the ER, and especially as a new grad, your goal is going to be to get experience. So shoot for the one that you really want, but then at least consider 1 other unit. It is okay to go ahead and apply early. I know that you haven't graduated, and I know that you're not 100% sure when you're going to take your boards, and we understand that. But we do move forward with interviews. We will move forward with hiring, and then we will set a start date, usually June, July timeframe. If that time comes around and you're not ready to start because you've been delayed with your boards, then we will be in touch with each other and we can rearrange your start dates. Once we receive your application through the online process, you can expect a phone call from one of our nurse recruiters. We would like to now be doing that as not just a phone call, but a Zoom or a FaceTime, something where we can see you personally. This social distancing has created changes for our hiring process as well. So if we're able to connect with you virtually, we'd like to do that. If we can only do a phone call at that moment, then that's okay. When we call you, our goal is really just to make sure that we've matched you with the right position. Did you apply to a part-time, but you really wanted a full-time? And just to share any information that you might need about benefits, the unit itself, any additional information and questions you might have. When it comes time for an interview from a hiring manager, currently we are doing our interviews over some kind of virtual platform. So we will work with you to determine what is best. And again, that could be FaceTime, WebEx, Zoom, and we will set that up. And we are not bringing you currently, because of COVID, into our hospitals for an interview if we can avoid it. And that is to protect everyone and to minimize your exposure and to save as much protective equipment as we possibly can. This is just simply an invitation to consider joining our team. It's a great place to work. While I'm on the subject of COVID, because I was talking about our interview process, I just want to share with you that we definitely are forward thinking, and we've definitely been preparing for this for more than a month, trying to get all of our processes ready. Some of the things we've done to minimize exposure and to prepare, we have set up telehealth for many of our urgent cares and for our physicians' practices. We have set up a respiratory phone line for our community to call and ask questions and perhaps have a phone assessment of their symptoms. We have set up many testing locations for COVID-19. And within our hospital, we have also set up a new unit that we are calling a high-intensity respiratory unit for patients that are either COVID positive or have the COVID-19 symptoms. So we're definitely not waiting for something to happen. We're trying to be as prepared as we can, and I'm awfully proud of our organization for that. So I'm going to stop sharing the presentation. I'm going to go back to the screen where I can see you, and you can ask any questions that you might have. I have been a nurse with Valley Health for 12 years. I did most of my time in labor and delivery newborn nursery. I did a small amount of time in surgical services at Valley Health. One of the things I love the most, and maybe even, I guess it was even before being a Magnet facility, just the ability to be able to connect with community members and to feel like I can connect with my patients, take time to review instructions for their own care, for their future medical needs, for their discharge. I said it was long before we became Magnet. They can go on and say, I only want to see jobs at Winchester Medical Center, or they can look at any of the other hospitals specifically, or they can look at all nursing positions across all of our hospitals. It's really user-friendly, and they can decide. You know, I feel like for us, when we're looking at new graduates coming into nursing, what we really want to see is that you can make eye contact. You have a certain level of compassion, emotional support to help take care of patients. You're a caring person. You're well organized. The nursing skills you have some of, and we can help teach you more of the nursing skills. We really want to see some of the other skills shining in you. Phone call that you're going to get from us, from one of our nurse recruiters, is going to be all the really easy questions. Did apply for part-time, or do you really want full-time? Those are going to be the super easy. Please don't be nervous about that first phone call. Tell me about a time when you had to deal with a difficult coworker or fellow student. How did you deal with that situation? If you want to do some research and some homework about how to answer those questions, if you Google behavioral health questions, or your career services may also have some of those type of questions. You can also expect to see more than one person interviewing with you. We don't do that to scare you. We do that because we want you to meet the other nurses, and we want them to meet you to make sure that there's going to be a good fit or a good comfort level with both ways. I think it's always a good question to ask kind of next steps. What can I expect next? About how long will it take until I hear something? If you liked the facility, if you liked the people that you interviewed with, and you want a position, I think it's perfectly okay to state that. I am very interested in working here. What else can I do? Are there more things you may need from me? So I think it's perfectly acceptable to state, where could I find myself in 5 years and in 10 years if I accept this position? I agree, and you know, it really helps keep people happy and engaged. You know, we don't want you to become bored in your position, or we don't want you to never get to experience another area that you've always dreamed of experiencing, because as a nurse, there are so many opportunities. So we always say, let us help you get there. And at the end of that presentation, there's a small video that I often show. Again, this virtual world is an adjustment for all of us, so I'm trying to keep things shorter. But that video is Ann Whiteside. She is RCNO. And that's kind of what she talks about in that video, how you may start your career in one area of Valley Health, but there are so many possibilities, and we do like to grow our own staff and help them succeed wherever they would like to be. That is okay. My title is Nurse Outreach, so I am more than happy to accept phone calls, emails, questions. If students just want to talk about, maybe there's a unit with a name and they don't understand what we might do on that unit, I'd be happy to answer any of those questions.